could be here with us. What we will do is I have an incredible panel, as you see, including Ruth Bush, Lowell Kabnick, Anil Hingorani, Kursat Bozkurt, and Victor Kanata. So I'd like to just open by saying that for all of us, and I think it's fair for me to speak to everybody regarding everyone here, that we all feel very strongly about the importance of education and of giving back. So with that said, I want to introduce you to our first speaker slash moderator, Ruth Bush, who's been my partner in crime in many of these. And I would really love for Ruth to first introduce yourself and tell us a little bit about what your thoughts are as well. I'm going to stop sharing so that if you do have slides or whatever that you would like to share with us, that you can go ahead and do so. So Ruth, if you want to go ahead and
sure.
Tell us why you think humanitarian efforts are important.
Sure. Can you all hear me?
Yes.
Great. Yes. No slides. Good morning, afternoon, evening, wherever you are. Thank you so much for the opportunity and privilege to be here talking about a topic that is near and dear to my heart, humanitarian medical work. So today we have the distinguished panel that Dr. Ozsvath joining us. These folks are clinicians, but what they also are educators. They're educators and they're people who give back. They're drawn together by a shared commitment to want to improve health awareness, improve health literacy, as well as human dignity in some challenging settings. I would say that humanitarian medical work to me is more than just providing care. It's about stepping into different day-to-day practice. We provide medical expertise, but what we provide is compassion. We provide human touch. We provide respect, regardless of the cultural context. This requires courage, humility, collaboration. There's going to be folks that want to be boots on the ground wherever it is, and there's folks that are going to be the support staff who are helping organize, helping their mark on whatever humanitarian effort there is, because we need everyone supporting. There's a lot of lessons learned that extend far beyond the field, and that can also help shape how you practice medicine in your day-to-day. Over the course of this session, the panelists are going to explore what it means to serve in different humanitarian contexts, some ethical and logistical considerations, the need for multidisciplinary teams, and how each of us can contribute meaningfully to health equity, including in our own countries. When I share the global work that I've done over the past 2 decades, most of which was basic primary care and general surgery in Haiti, I remind folks that your mission field can be your backyard. It can be your backyard. We have so many in the US, underinsured, uninsured persons, healthcare deserts without access, lack of awareness, lack of trust with the healthcare profession. I will say that many professional medical organizations have started hosting a day of service to give back through a community event. These community events are not about killer surgery or about whatever discipline. It's really to raise health literacy, to give an opportunity for the community members to come together, to provide a safe space to discuss basics of healthcare, whether it is flu shots, blood pressure, foot care, diet, other topics. So again, your mission field can be your backyard. So with that, I want to hear from firsthand experience and get some deep insights into this very important work. So I will hand back to you, Kathleen. You're on mute.
Sorry about that. I was muted. I muted myself. I have some pictures I would like to share because, as you know, we've been partners in crime in this in more than just one way, right? We've done this with other groups as well. So let me see if I can share my screen, because I would love to show everybody some of the fun things that we've done together. Give me 1 second, because I'm not great with technology. Here we go. Let me go back to the, there we go. So this is a recent event that you and I were in, as well as Dr. Hingorani. He actually ran this, and it was incredible. The Eastern Vascular. Here's some other images of you and me together, as well as Dr. Hingorani was there as well. This was the American Venous Forum, where we worked together to give back to the community here in the United States. Do you mind just giving us a little rundown of your perspective of how that worked and what was important to you personally?
Me?
Yes.
Yep. So these events have been really engaging. We have done 6 of them now with 3 different 2 different organizations in multiple 3 organizations in multiple locations. What has been really important is working with a local community organization, whether that is a community center or it's a church in the area that already has the trust of a community that they are in, because it's not about us, it is about them. It is about what the community needs are. The top billing on anything is not the American Venous Forum or the Eastern Vascular. Nobody cares about that. What they care about is what that center is and what some of the local healthcare organizations that they trust are. So we have worked with local medical schools, HBCUs, cities, county hospitals, food pantries, names that the community trusts. So I think there have been a lot of lessons learned over time, and we have learned, again, it is community centric, it is community needs first, and it has been delightful, and we can help one person raise their awareness, then we have done our job. Anil spearheaded this last one. I'm going to hand the mic over to you, Anil.
Yes, I think I'm going to go over a little bit some of the lessons learned and some of the advantages, but I do think it's an important new directions for societies to focus upon. Traditionally, we've actually been focused on the science and the art and talking to ourselves. This is a different direction, and we'll explore some of these. And I do think it's an important new idea, and I do think it is spreading.
Thank you so much for that. What I would love to do next is to turn it over to a very special person who's been my mentor for decades now, and who really came up with this concept of VLU, and that's Dr. Lowell Kabnick. So I would love to ask Dr. Kabnick to tell us a little bit about sort of how did he come to this whole idea of education globally through VLU, and see what your comments are about setting these programs up, and what you feel are some of the pitfalls. I'll stop there. Do you want to share your screen, or tell me what's easiest for you?
Thank you. I don't have to share my screen. I'm just going to talk ad lib. I think that this is a wonderful concept that came to fruition by hard work, but the concept was something that we all on the team here know about what it takes to give back. And the concept was really, I had reached the pinnacle of my career, and I really wanted to give back without any political ties, and an organization that was basically looking to improve patient outcome through education. education of our trainees, education of our attendings, colleagues, to really put forth the current information, the current technology in areas that are served as well as underserved. And so through the hard work of our executive board, and you're seeing them here, except for Victor Canada, but if you look at Kathleen Ozsvath, Ruth Bush, Kursat Bozkurt, and Anil Hingorani, each one of them has an asset that they have brought forth to the executive board to really bring home our mission. And our mission is unselfish education. And so we are not a society, we're an organization. And the only pitfall that I can see, there are two of them. One, we have limitations on our WhatsApp group. We have an educational group on WhatsApp, and we're limited to over 1,000 members. And it's really a chat group that talks about cases, answers to problems, etc. It's phenomenal. And if I don't look at it, my phone will blow up with all sorts of information. Hopefully we will be able to extend that, but right now our WhatsApp group is limited. In terms of education, Anil Hingorani is in charge of VLU Voices, which is a periodical that comes out more than we expected. So thank you for that. It's almost every 6 weeks, if not more. And it gives little snippets as to what we're doing, sound bites, so to speak, 6 minutes. They can be interviews of people. They can be educational pieces that have been written so that they can extend, and then that can go into our webinars, etc., for a little bit more information. And then what we've talked about is humanitarian work, and that's really what really makes me happy. So we go to areas for the mission of education, and as we progress, Professor Bozkurt is in charge of our humanitarian project, and it was really successful in our first mission to Mexico. It was so well received that we've been invited back. We spent time with our trainees as well as even attendings. We did over 60 lower extremities in 2.5 days. So we were quite busy. And it was phenomenal to see the trainees actually gain the experience, because not only did they scrub with us, but they were our scrub nurse. And then I was really happy because I did the last case with a vascular resident. And I said, "Are you ready to do this?" And she hadn't done a case before. It was happened to have been a thermal case. And she got right in. Everybody took pictures. The rest of the residents were applauding. And it just, it's rewarding. We all teach, and we know what it feels like to see success. And that's what this is about. This is nothing more, nothing less than to give back through education, through humanitarian, and to improve patient outcome. Thank you for the ability to express this, Kathleen.
You have been such a mentor to me over the years. I mean, you were my attending when I was just a resident. And by doing what you did, which is not only teach me vascular surgery, but also to be such an incredible role model and open up so many opportunities for me that I didn't even realize that I could have. And I think that that's something really huge and something that a true educator does. And I really appreciate you for that. With that said,
hold on a second. I would like to get involved here because we learn from each other. And I think that, yes, thank you for all of those accolades, but what goes around comes around. And if you look at the work that we all do, including Ruth Bush, in terms of her JVS VNL editorship, chief editor in charge, I mean, it's just amazing of what we all do outside of VLU, and we have contributed to this. So from the bottom of my heart, thank you for the contributions.
Well, thank you for saying that. With that said, tell me what you think some of the difficulties are when you're trying to reach a global audience. Because as you just pointed out, if you open up your phone, the VLU WhatsApp group is blown up. But how do you reach those people who are not in that group?
So it's through these constant different ways of we educate, whether it be through VLU Voices, whether it be through the webinars. And we have help from Solos, which is a admin group that will take our emails and broadcast it. But everybody's busy. And so we know that you can't be on every webinar or read everything. But these are memorialized on YouTube. We have all sorts of social media available for you to go and look at, including, as I said, YouTube as well as LinkedIn, and we have our own webpage. So the information's there. You just have to have the time or the interest to go see it.
When there are people that are interested in, VLU or any of the other efforts that you're involved in when it comes to education, what do you say to the young, venous specialist who's just getting started? What are some of the ways that you think that that person could be included, or that we can have join in some way? What are those opportunities that you see?
I think that we are here also to mentor these beginning or early career people, or even people in training. And each one of us is willing to do that. And then committee work. You know, we all started somewhere, and we all started in a society somewhere or in our university, and we worked up and we were mentored, and you identify with somebody that can help you. And we're here to do that. So in the future, we might develop a mentor program as well for those people who are interested. If people are interested, as you have cited, then they can contact one of us. They can contact us through VLU. They can contact me directly. Any one of us will be willing to have people reach out to us and accept that. And thank you for that question.
Of course. At the end of this, we're going to come back and have each of the panelists on for further questions, but I would like to move, if I can, to our next panelist here, Dr. Bozkurt, who has been instrumental in setting up these humanitarian efforts. And I think the most important question comes from the complexity, right? It's one thing to set up something in your own backyard, and it's another thing to set up something in the big world. So I would love for you to sort of tell us first about yourself, and how did you come to VLU? And then could you tell us a little bit about what it took to set up the humanitarian effort that Dr. Kabnick just described?
First of all, I want to thank you all for accepting me to VLU, and specifically Dr. Kabnick, who appointed me as the responsible guy from the humanitarian mission. I'm from Istanbul, from Turkey. I'm a cardiovascular surgeon. I have several international commitments. And I want to make you a short presentation to understand what's going on. I understand you can see my slides, Kathleen, is it correct?
No, I'm going to stop sharing. So here goes. I just stopped. So go ahead and start sharing.
Can you see now or not?
I don't see your slides. I see
Lowell,
you.
Lowell, can you see? Lowell? I think Lowell can see. Is it correct?
I can see them.
I can see them.
Okay, then. Okay, I can
Perfect.
continue. Right. First of all, if you want to do a mission, you have to find the right institution and definitely the right people. There are some big problems in different countries, and also making connections are very important. My scenario actually started in Turkey several years ago. There is an organization in our country which is TICA. TICA is a government organization, and the aim of this organization is to do international aid humanitarian projects outside Turkey. Actually, it started with the ex-Soviet Republic countries like Azerbaijan, Tajikistan, Kyrgyzstan, Kazakhstan. These are Turkish-speaking countries. But after that, the aim, the scope widened, and this group started to do in different countries, including Latin America. They also have a bureau in Latin America, and they are actually supporting these countries for humanitarian missions. In 2024, I prepared the project, and I asked them to help us as a Turkish Society of Cardiovascular Surgery, humanitarian somewhere in Latin America. And we asked them, in reality, a big amount of money. But after that, I had to find a good leaders to do this one. I knew Professor Kabnick and Professor Kanata for years, and I asked them, what can we do? And Professor Kabnick and Victor encouraged me to do some projects with VLU. But there are big problems here. First of all, it's a complex procedure, registration of the doctors in these countries. For example, if you ask me to help you in a project in the United States, I know it is almost impossible for me because I don't have any registration in United States. There are very strict rules in the United States. But every country also have very registration issues for foreign doctors. First of all, this one should be sorted out. I know we are going to do these procedures with the local doctors, but even to touch the patient, it needs some registration. So this is a big problem. Social security system in this country, for example, in some countries, the government doesn't let you do anything for your patients without social security. For example, in my country, 99% of the patients do have social security, and it's really very difficult to organize anything in my country. Language is a big problem. In Mexico, we had this problem. Although we had a very good translator, we had a big problems in language. Recently, we had a meeting with Professor Kabnick with Vietnamese doctors in Singapore. And again, language is a big barrier because not all people can speak English. Even maybe you're gonna think it's very easy thing, but electricity is a problem. When we are organizing mission in Mexico, I brought some devices from here, and we had some difficulties to run these devices because in Turkey the electricity is 220, in America and Mexico is 10. Season is important. I mean, for me, for example, summertime might be winter in other parts of the world, and transportation is important. Believe me, the most difficult thing we solve in Mexico project is transportation. We sent the materials, came back, we sent again, we couldn't find them in the custom, and a big problem. Also, personal transportation, flights are complicated. I mean, sometimes they are canceling the flights sometimes. So we have very, very big difficulties to do that. Then we started to think together with you all together, which countries we can do this project. As a PRU executive committee, we had long discussions with that. We thought Nigeria, was good, but big safety issues. Ethiopia, I love Ethiopia. I've been 2 times there. It's nice, should be something done there, but again, safety problems. After that, basically, actually, at the beginning, we thought and partly we decided to do the first project in Cuba. We have a very good contact person there. They wanted to do it too much. But what happened is we started to negotiate with the industry, and they told us, doctors, you can't sort out the custom problems in Cuba. Just forget it. Then we had to forget Cuba as well. Then with the suggestion of Lowell Kabnick and also with the support of our best friends, Rebecca, we decided this project in Mexico. We are very lucky because we are a very good team. We are very good friends. And Rebecca from Mexico, she was really, really great. And we decided to do this project. And now we are in front of the hospital in Guadalajara. You're going to ask me why Guadalajara? Because Rebecca decided Guadalajara is the best area for us. Now, we had a very big checklist. I can't tell you all of them, but as you can see, starting from our flights to Guadalajara, transfer in the hotel, catering of the doctors, providing necessary materials, all were big issues. Fortunately, we had no problems for providing materials. The industry was very, very helpful for us. And believe me, we didn't pay anything for these devices. And we had enough material, more than we can use in that scenario. As you can see, glue devices, radiofrequency devices, foam devices, clear vein, and we were able to use everything and without any money. The main issue was patients. We have to have 50 patients to go there to do this project. And fortunately, the local team and Rebecca was very, very nice, and they sorted out all of the problems. There are a lot of details. For example, I specifically wrote here, we needed a Spanish post-procedure later, for example, kindly root push prepare, this one. So everything are in details, the success in details, and it is very important to do them. Some of the materials you can use from hospital, some of them you cannot use. For example, we brought a lot of devices from our countries as well. We had a catheter crisis there. What happened is, I sent from Turkey the first group of catheters to Rebecca, to his office, but DHL refused to give these catheters to them because of the custom regulation problems. Now we lost these catheters. We don't know where are they now. Just disappeared. We don't know what happened to these catheters because it's stuck in the custom in Guadalajara or somewhere in the Mexico. Then I brought with my luggage another 20 catheters with my luggage. What happened is, in Mexico City, they took them without saying anything. So we were in Guadalajara, no glue catheters. We were just waiting there. Then our guide did a very good job. We paid some money there, and at the end we have able to get our catheters. What I am saying here is custom regulations are very strict and very difficult for. But at the end, we did a very good job. We had a lot of patients. We did a lot of training. I do remember very well, in order to train, Dr. Kabnick spent 2 hours. One case, 2 hours. Normally, he can do in 10 minutes, 20 minutes, this case. I know him. We worked with him in Istanbul as well for a while. For 10, 20 minutes for him. But he was very, very educative, and he helped him a lot. It took 2 hours. And with Victor Kanata, with Ruth Bush, with Anil, we really made a very good job. This is soon after the first day. Can you see? All of us are smiling actually, but we are unbelievably tired. For example, this day we couldn't. we decided to eat something in the hotel. In the top of the hotel, there was a pizza restaurant, only pizza, nothing else than the pizza. We ate our pizzas and then directly we went to the, you can see all of us very energetic, very strong, but it was soon after. And the luggage in front of the Anil is the material we are carrying because, because of the safety issue. We wanted to take them, some of them, to a special place, something like that. This gentleman really in front was responsible surgeon for local wise, but you can see all smiling faces after the first day. You can see, I mean, very good. And the patient is sitting there. What we did there, we trained 68 physicians. Sorry, we 38 patients over 60 legs, and we did all of the superficial procedures available in the world now, except HIFU, but nobody is using HIFU. We did foam sclerotherapy, we did glue, both glues, sclerosave, laser, radiofrequency ablation, we did everything. And definitely, as organizers, we now planning to do projects in Vietnam next year. We had a discussion in Singapore together with Lowell Kabnick, with the doctors from Vietnam. They are very enthusiastic for this project, but again, now we are trying to sort out the registration issues there. And also Bangladesh want us to do something next year. And in the original plan in 2026, we were planning to go to India, a rural area of India, but we'll see. Now our idea is to do that project first in Vietnam next year. As you can see, this is our team: Lowell Kabnick, myself, Ruth Bush, Victor Kanata, Rebecca, and Anil Hingorani, all were there. I'm very happy to be a part of this meeting. And believe me, for 20 years, I'm organizing every year 1 or 2 national, international meetings. But this project was the most satisfying project in my life. I can easily and honestly say that. Thanks a lot.
Thank you
Done.
so much. Thank
My
you so
pleasure.
much, Kursat. That was amazing. And I love looking at those pictures and having fond memories, and also how absolutely exhausted we were at the end of each day. Dr. Kabnick, you have a comment to make about that trip and others?
I wanted to sing accolades to a partner in crime, Victor Kanata, because even though it was a concept that I came up with, he has championed it and has actually taken the ball and run with it. He is our social media guru. He works really hard. Right now, we are in a process, as we're talking, teaching a kind of like a small humanitarian mission. So we're teaching with hands-on experience for VLU here in Paraguay. We have 6 students from around the world, as far as Australia and as close as one of the South American countries. So it's really a good opportunity. I am going to smile at Kursat because he said he enunciated many times that we spend time to teach. It's not about running through a case. Of course, we have to be patient aware, but I think it's really important as we give back, and time is not of the essence when we're teaching. Although when you have 60 patients, you need to be aware of that. And having performed 16 lower extremities during that time, you saw me kind of passed out in the seat. But it is all teamwork, and it is very important. And we go through this, and that's what it's about. So thank you for allowing me to come back in and just give praise to all the people that have helped. I'm sorry that I'm making this as a praiseworthy thing, as opposed to what it is that it takes to organize. And the organization is very important in how we organize the different modalities. So thank you.
Right. Thank you for that. Lastly, we will hear from Dr. Hingorani, who has been critical in helping organize both in and out of country humanitarian events. Dr. Hingorani.
Thank you. Can you see my slides okay?
Yes.
Okay, great. So we're going to be shifting a little bit, and we're going to be looking at some of the national experience that we've had with Day of Services at the Eastern Vascular Society, the International Society for Women Vascular Surgeons, American Venous Forum. We had prior days of experiences across the country, as Dr. Bush had mentioned before, across these various societies, and in conjunction with the annual meetings. Traditionally, when we have our annual meetings at various local national societies, we come in, we have a great exchange with our colleagues, we talk about the art and science of vascular surgery, medicine, venous surgery and medicine, and then we leave. And what type of impact do we really have upon the various places that we meet, that we go to? And we started to question this, and we said, maybe there's something we can do more to really help the community, at least on a short and midterm basis, and hopefully on a long-term basis. I'm just going to go over a video of some of our, hopefully this will play, one of our prior meetings that we had. Can you see my screen?
No, not yet. Now it's coming. There you go.
I just want to thank everyone who put that together. That was a prior meeting. We also had a recent day of service um, with the Eastern Vascular Society recently. So we have to remain really careful and remain true to our North Star. The purpose of these day of services is really to educate the public, as we mentioned before, and serve the underserved. What worked? Well, quite frankly, as Dr. Kursat had mentioned before, having multiple members on the steering committee, and we were fortunate to have a steering committee across all of these various days of out services that have been dynamite. Dr. Ozsvath, Dr. Ruth Bush, Dr. Misaki Kiguchi, Dr. Sherry Wright are the engine, are the creative ideas, and the energy behind each of these day of services. And they really bring together all of their different skill sets and ideas that really help move this forward. We start planning these a year in advance at least. And one of the major areas of focus is to rely on local services, not only relying on the churches and the community centers, the physicians, but remember, as Dr. Bush had mentioned, also having the podiatrists, physical therapists, etc. Another thing that helped, as we can see here, having the local institutions, as Dr. Ozsvath had said 8 days ago, we had a day of service down in Nashville. The local hospitals were key to making certain that we had good input and were able to reach out to communities. The local pharmacy helped provide the COVID-19 and the flu vaccines. We also had an insurance company there that was helping provide insurance to those who were underinsured or uninsured. And of course, having other facilities available, even outside of vascular surgery and medicine, such as the donor services from Tennessee Donor Services, and of course, the local church. The local church we were at this time was a key component. They really helped bring this community together, advertise, and help get everyone together in terms of organizing, because what did not work? 20 years ago, we tried to do a AAA screening with Medtronic at one of the national meetings, and we had really expensive, beautiful shuttles that brought everyone from the community into the site of the meeting. Did not work. We need to go out to the community and bring services that are not available, education, to the community. If you make it inconvenient, it's not going to work. Cold calling in terms of preparation, I was calling from South Brooklyn, calling these people in Nashville, Tennessee, sports, local newspapers, hospitals. They didn't know me from a hole in the wall, so they didn't respond. However, the local church, the local people, the local physicians, they know geography, they know the local politics, they know the people, they have the connections. They were the ones who were really able to get the job done. You need to have a local organizing team with boots on the ground who know the ins and outs, have all the connections, and they'll actually get the job done. Well, the point of care ultrasound was very popular and very useful. We didn't really have enough space during the last one that we had 8 days ago, and we probably needed to set up a separate screening area to screen abdominal exams for AAAs, lower extremities, etc., and really fully take care of the patients that we were seeing with, at least in terms of the in terms of point of care ultrasound. I thought we had set up the follow-up fairly well if we had a positive finding with the local community physicians. Remember, you're not licensed in different states to diagnose and treat. You need, if you have a positive finding on ABIs or a history and physical or an ultrasound, that needs to be referred to the local physicians who are board certified in that state. Industry support has been amazingly strong. Industry is very interested in supporting these. This is a brand new initiative across all of industry. During the last day of service, we had amazing industry support. Even industry that didn't have anything to show to patients directly, they're interested in supporting this. It's a new initiative, and I think it's going to continue to grow. Keep it simple. The standard, of course, is to have everything written at an 8th grade level. No, I would probably say it needs to even go beyond that. Go to a 5th grade level for handouts, presentations, and flyers. Keep it personal. Patients want to hear you one-to-one, eyeball to eyeball. Yeah, it's great to have some presentations, but the reality is that you really want to get to know the patients one-on-one. I found that to be very effective. We often have many practitioners at these meetings and a lot more patients. Having the eyeball to eyeball connections, getting a history, getting a short physical, and then referring them for an ABI or referring them for a local physician or that's all important. Involving the students in the area, APPs and nurses, they are so energetic, they are so creative and have great ideas. It's really amazing to see them work at these, and they're very, very motivated. Don't forget other services besides the physical services. Mental health services, other screening, such as podiatry or mammography is also important. And when it's appropriate, use multiple language for signage, flyers, and handouts. The day of the event, arrive at least 3 to 4 hours before the day of service event. There's always things you're going to find that need to be fixed. Have handouts for the local institutions with free clinics and sliding fees. I actually had to call each one of these places to make certain that they were still around, because some of them I found were not. So yes, make certain that you have handouts directly for patients and guests to make certain that if they do have something or questions, they can refer up to the local services. The things that were really popular, the ABI screening, blood pressure screening, diabetes screening, and the flu and COVID vaccines were wildly popular. Again, bringing the services to the community, not the other way around. Things that may not be available, the education is really important. As simple as keeping track of how many guests. Yes, it's great to have someone at the front desk just saying, hello, please come in, please have a seat, please register here. But keeping track of how many guests you have is important. And of course, the free meal and giveaways is always important. Here's just an example of some of our volunteers who are walking across the street down to the local community, to the local churches, handing out eyeball to eyeball, hand to hand flyers to let people know about the event. That's really important and really does help get, again, boots on the ground. After the event, we want to thank all the participants, the volunteers, and industry partners. I also suggest a debriefing same day of the event or within 3 days of the event. Don't go out further than that, because after that, people are going to forget, and we're all busy and it's hard to get everyone together. Remember to send all the pictures and videos to all of those involved, and invite local media to help advertise before and after the event. We were very fortunate to have the vascular specialist describe some of the prior day of service events that we had on the front page. So I think that was really, really helpful. Thank you. Looking forward to the questions.
That was great, Anil. There were so many lessons learned from the international humanitarian trip, as well as the ones that we have done. And again, I think that the major lesson learned is about the educational piece. It's not just doing a short-term pop in and pop out, whether it's in country or out of country. It's really educating people on the ground, whether it is the client that comes in or it's the resident, the trainee, the student, so that it can be a sustainable, something that sustains beyond the time that we are actually in another country. So teaching the person how to fish, not just giving them a fish. So it's been wonderful to hear from everyone. I don't know, Lowell, if Dr. Victor is there and wants to say a few words. We are a little short on time, and I'd like to leave it open for any questions that we may have not introduced.
I believe Victor's involved in a case right now,
Okay.
teaching. Let's go directly to questions.
So I think one of the questions that when folks watch this webinar will want to ask is, how can they get involved? How can they get involved if their organization's not doing a day of service, if they're not part of VLU? How can they get involved, Dr. Kabnick?
Just contact one of us. Very simple. You're welcome to give my email address online in the chat box, or I can do that. Happy to do that. And anybody else that's on this phone call, please use the chat box for contacts.
I do have a quick question. Can either Dr. Kabnick or Dr. Bozkurt, can you guys just tell us what a little bit more about what the future plans are? I know that there's maybe Bangladesh, maybe Vietnam. What are you foresee us doing in the future?
Actually, Professor Kabnick thinks two organizations per year. Am I right, Professor? 2 organizations per year.
Well, we like to walk slowly, We were really, really successful. We'd like to probably, as you recommended, to do one next year and see how that goes. If we can footprint this so that it's easy to organize, then yes. Right now, we're in our beginning throes, and you know best hand of how much time it takes to organize and to dot your I's and cross your T's. Yes, I would love to do two, but I'm trying to be practical.
So the practical answer to the question is actually it depends on the sponsorship. Definitely, we need some support from industry, from other organizations. I mean, we did well in Mexican mission, and probably we are okay for Vietnam now. We already confirmed our support for Vietnam business. There's no question about that. Depends. Yes, Vietnam or Bangladesh next year, and 2027 possibly India, and we'll see how it goes. So Nigeria also might be a good choice if we can understand the safety issues there. But the plan is now Vietnam, and we concentrated ourselves to Vietnam mission now.
That's super exciting. One of the questions I would have is, again, if somebody is interested in doing this, how do they get involved? And how can we find local experts to help us with this?
First of all, because of my position in UIP, we know almost all countries who's doing what. Also, Victor, you, Professor Kabnick are well-known figures, and actually each of us knows who is critical persons there. For example, I do have a big connections with Far East for Asian Society of Vascular Surgery, Asian Venous Forum. I can, for example, find the correct local persons there. In the meantime, you are very good in America, including South America, and we also have good connections. It's not a big problem. I believe the most important thing for doing this procedure is first registration of the country and economics. The others are okay.
I think that the biggest problem is all the people that want to contribute. And how do you select these people to join this mission? And I'm going to leave that up to the panel because I find that very problematic with all the interest in this and how to do that. And it's amazing that people, our colleagues, want to do this with vigor and are willing to give up their time and practice. And it's just amazing. So I leave that question for further discussion if you want to handle that now, or we should handle that offline. But that's the biggest problem that I see.
Yep. No, I mean, I think it's an incredible mission that needs to continue to happen. And again, amazing job to all of you that have done the first one and are gonna, as we go forward, doing new ones. Just want to open it up to any further comments or questions to the panelists.
I just want to highlight one thing that Dr. Bush was hinting at, and was really that we, after the event, that we really do follow up and make certain that if there are any positive findings, what the subsequent follow-up is with the church or the community center. And yes, we've had things. If you screen patients and are doing procedures, you're going to have some interesting areas that need to be followed up. So it's not a one-off. It's really meant to be something. And having those contacts, I think, is quite valuable, and having them on the local area, the institutions in the local area, the free clinics, the student-run clinics are a great resource also. And the enthusiasm on the part of students, trainees, nurses, physicians, and industry has really been overwhelming. So I would really tap into those. they have some great ideas. I had a student who was talking to a patient at one of the prior day of services, and it was quite clear that the client was having some problems communicating. And the student realized that the guest spoke Mandarin Chinese. And then this is a student I've known for a year and a half. She's one of our students at one of our local schools. And she started to speak to her in Mandarin Chinese. I was floored. I had no idea. And she was able to find out what the problem was and really um, get the job done in terms of getting this person the resources that she needed. So yes, having the students, the others, the nurses, the PAs, they're great resources.
Thank you for that. It is getting close to ending time, so I really just wanted to thank these incredible panelists and my co-moderator and dear friend Ruth Bush. Again, Lowell Kabnick, Kursat Bozkurt, Anil Hingorani, Victor Kanata, who's busy actually taking care of patients as we speak. Thank you all for your incredible expertise, your mentorship, your sponsorship, and your leadership, and really taking education forward. And we all appreciate for that. I would also like to invite you to the next Empower All, which is going to be on October 18th, where we'll be discussing some important issues regarding perforator veins. So please join us then. And again, thank you all for being on this call today and this webinar. So appreciate all of you.
All right. Thank you all and have a great rest of the weekend.
Thank you.
Thanks a lot, everybody.